My name's Natalie or Nellies, and I'm a sister of somebody who's used the services for a long period of time. So it must be somewhere between 15 and 20 years ago, he first used the Edward Meyer service, where he came in for inpatient detox, and that was due to alcohol dependency. He's had 2 or 3 detoxes. I think it was 2 from alcohol dependency and 1 detox from substances, which I think was heroin at the time. Following on from that, we've had engagement with the services through 2 or 3 sections, and also engagement with the service from community mental health services, such as the Greenfield and RAID team, I believe it was called. I don't know if it's still called that now, which is like a duty assessment team. I found the in-house ones, so the inpatient ones, which was his detox in Edward Myers. I found those services really good. Some wonderful people working there, and I think the inpatient services do a fabulous job. For me, it's the point of discharge and the lack of support after that's a major concern. It hasn't been very positive. So there's been a couple of times where my brother's been an inpatient in the main hospital due to quite serious physical problems, including abscesses on his legs. There was an incident where he'd got some kind of virus where his lungs filled up, and he spent 2 to 3 months in hospital at the time. The nurses and another doctor had been monitoring him, and they'd noticed as well that there was a rapid deterioration in his mental health. At that point, the RAID team came to assess him and assess that he was okay to go back in the community. He didn't have mobile phones at the time. He used to change his mobile phone 2 to 3 times because he believed that somebody was tracking him on his mobile phone. He wouldn't answer unknown calls. That was discussed in his assessment, yet on completion of assessment, the outcome was, and it was wrote on a piece of paper for him, that the RAID team will call you in 2 to 3 days to complete an assessment on the mobile phone number provided by the hospital. So at that point, there was no way that anybody was going to be able to communicate with him. From then, we had a multidisciplinary team meeting, which involved social care team at the main hospital, services that were trying to engage with him at the time, and myself. So it was decided at that meeting that he wasn't safe to leave the hospital. So adult social care and the duty team blocked him being discharged from hospital through their services. That was on a Friday. From the Friday, Saturday and Sunday, the main hospital tried their best to discharge him. It was on the Monday morning, 2 lovely doctors from the mental health services, and I believe it was like an independent mental health nurse or something. They assessed him, and they did section him at that point for assessment. So we were really lucky on that Monday morning that the doctors were able to come over and to see for themselves what was happening. I just think it's so sad that throughout that experience, if there wasn't people like myself who know a bit about the services able to fight his corner, he would have been discharged into the snow, and he may not be here today. He was due to have an assessment from Greenfield. We all believed that Gary had a mental health worker. So I was challenging, why is it taking so long? To then be told by the said mental health worker, he's not even on the books. Now, this mental health worker had been attending these meetings for over a year. I do know that a formal complaint was raised at that point, and he was then allocated on the books to the same mental health worker. So nothing had taken place. Following from this, he was hospitalised again for a problem with his lungs, his heart and something else, and it was all due to severe self-neglect. Now, bear in mind, he still hadn't had a care and support needs assessment because he's waiting mental health assessment. Adult social care wanted the mental health assessment done first, so we were stuck. At that point, he was an inpatient in the main hospital for 2 months. It was 2 to 3 months. And still the mental health worker didn't even come and see him to complete the assessment. So at that point we were really getting quite desperate. Up until this day, I'm still not sure if a full assessment's actually been completed. I had a conversation with his mental health worker. This was not last December, the December before, so approximately 3 years after first being allocated this mental health worker to do the assessment. where we did go through, we finally sat down for 3 hours of my time as well. Quite emotional, quite traumatic experience for me, where we went through his childhood, we went through things that had happened in his childhood. So we did go through all that, only to find out 6 months later it hadn't even been wrote down and recorded. Whilst I understand that when you're doing assessments, things like that, the information's got to come from that person, or you've got to observe that behaviour. But to not even have it recorded, it was heartbreaking. But our experience of the Edward Myers unit has been absolutely fantastic. He was, at the time, I remember thinking, actually, he was treated like a human being. And it wasn't, oh, you're in here because you do this, that and the other. There was none of that. And they were very kind and very considerate. So I will say that. When I used to, so you'd get like visitation times, and they were very accommodating to family members and friends, and it was a nice atmosphere to be in as well. And I know it's very difficult for people to go through detox and things like that, but the nurses there made sure that everything was in place, and they explained things really well. They would explain things and they would do it in a calm manner, and perhaps if he was getting a bit, frustrated and getting a bit angry, they never took it personally. Whereas you see some services when, somebody starts shouting because they're frustrated, "Don't you shout at me." Well, that just escalates it. And I do have to say the Edward Myers team were very well trained on that, and you could tell they were doing it for the right reasons. So I do have to say that was wonderful. At the Edward Myers, if you asked any questions and they didn't know whether they were allowed to answer you or not, because obviously it's down to the patient, they will actually say to you, "I don't know if I've got consent to discuss that, so I'll check and I'll come back to you. And if I can, I can, and if I can't, I can't." And that, as a family member who cares deeply about you, like this case, it was my brother, that's really nice to have someone be honest and speak to you like a human being, and also not talk down to you. They also don't use, in the Edward Myers unit, they don't seem to use like medical terms and acronyms and things like that. It is just a conversation, and they don't act like they're any better than you, which is really nice. For me, it's all well and good asking for service, as they call it, service user feedback, carers feedback, all the rest of it. It's actually, what are you going to do with it? The pathways on paper work, but actually on the ground they don't. So how are you going to evidence what changes are going to be made, and whether those changes actually have the desired impact? I think the fall down as well could be, I think I touched on it before, you can start gathering that information, so that then perhaps that person doesn't have to sit there for hours on end having an assessment. Actually, you've talked to family members, you've talked to services that support them, you've talked to the police who may have sectioned them before. So there is a massive disjoint between homeless services, the main hospital, mental health services such as Hartlands, Edward Myers, things like that, and local authority. And there's problems between adult social care and the mental health services, so the way they interact together. So there is that. I think as well that it would be worth looking at the hidden groups, so people like rough sleeping, homeless services. I think also what absolutely fascinates me is the fact that a lot of mental health problems start at a young age. How are you going to engage with those young people? Because actually it's those young people who, if we don't get it right, 20 years later, they're going to end up like my brother, waiting to have their leg amputated because of severe neglect and because of their mental health and because the services haven't been able to pick them up. The other thing I'd like to say to the Trust is, whilst there are absolutely great services out there, so charitable sector, work better with them. Don't do a tick box exercise. I would say look at it independently and ask the right questions. And just because the customer group, or whatever you want to call them, are too challenging, you don't give up on them. Keep trying, you find a way to engage with them. And I think it's about time we start looking at preventative services rather than services that respond in a crisis, or actually don't respond in a crisis in some ways. So yeah, that's what I would say on that one. Start looking at what they can do now, what you can put in place now that will help people in the future, because actually their lives are invaluable. And the costs later on, because I know We're facing cutbacks. I dare say after the pandemic there'll be even more cuts and all the rest of it, and there'll be even more people needing mental health services. But actually, not only the human cost, but the financial cost. If you just look at the cost of sectioning someone compared to the cost of actually assessing them properly when they're in their early 20s and the first signs start showing up, then helps everybody, doesn't it? So